And now we're going to move to our next speaker, Dr. Gal Noyman Veksler, the Vice President of Data Science Group in Israel, the Vice President of Business Development, actually, to be correct. Hello, Gal, how are you?
Hello, everyone. It's a pleasure to be here. My name is Gal. I'm the VP Business Development of the Data Science Group, as well as the Director of DSG Health. DSG is a global AI center of excellence operating from Tel Aviv for the past 6 years, I believe. As for myself, I come from a background of PhD in clinical and neuropsychology in the world of chronic pain. I developed a biopsychosocial model to predict pain outcomes, for which I received the National Wolf Award, as well as background in venture capital and entrepreneurship, including own startup in the field of opioids. So I'm here today to talk to you a little bit about the role of AI in healthcare and how to get it right. So a little bit about DSG. As I mentioned, DSG was founded about 6 years ago by Dr. Gideon Rosenthal and Dr. Ilan Sasson, with the purpose of developing end-to-end AI business solutions across all industries that are robust. Meaning they wanted these two researchers wanted to integrate their business background and their research background to really use artificial intelligence in a robust, evidence-way manner to deliver value to business stakeholders. And when we're talking about healthcare, the value will be improving clinical outcome, it can be reducing costs, it could be optimizing operations, or don't know what. DSG is made of 2 other divisions. One is Evolve, an AI performance management platform, predicting deterioration of the accuracy of AI models over time. As we all know, data is dynamic. It constantly changes. Maybe you heard of a little thing called COVID-19. It changed our world a bit and our EMRs as well. And we need to find a solution that makes sure that all AI models remain accurate and reliable over time. The third division, MDPI, an EMR feature store and a clinical decision support system with AI/ML disease-specific algorithms to provide clinicians with measure to predict the likelihood of a patient to deteriorate. So we've done a lot of work with large corporates in the healthcare space and above, and we found that there is a lot of cross-vertical knowledge that provides value. Because if I want you guys to take anything from my message, from my talk today here, there is no AI in a box, and you need explainability in healthcare, and you need reliability, and you need to monitor it, and you need to have the right scientific methodology and applications to do it the right way. So a bit about our leadership. We all come from very strong academic background. Dr. Amjad Abu-Ramila coming from Microsoft R&D, as well as the academia, Gideon and Ilan, which I mentioned. We take pride in Dr. Orna Berry, our advisor, who is leading the National AI Council in Israel. So let's talk a little bit about healthcare. We have a very fragmented market. Whether we're talking about Greece, we're talking about Israel, we're talking about the United States, we have a lot of players with different motivations and different types of data. Whether we're talking about EMR, we're talking about genomic data, about imaging data, about signal data. And this is crucial because we need to treat the different data in a different way. And the other thing that is also crucial is we need to take into account the different motivations of these stakeholders. Because if a provider would want to reduce readmissions within 30 days in the US and use AI to do that, then an insurance company might want to do it for preventative medicine, and a pharma company will want to optimize adherence in their clinical trial, and each come from a different set of motivations and different goals for the AI solution to achieve. So we talked a little bit about what's happening in the space. Everyone wants to be in healthcare these days, especially in technology. There are a lot of funding in this field and a lot of costs that we want to reduce. Just to highlight a few. So Google is doing some work these days about robotic assisted surgery, a lot of cybersecurity, as well as optimizing triage processes and improving treatment efficacy, of course. what do we want to take into account when we're talking about key issues in AI in healthcare? We want to consider privacy and data access and the many data sources and databases. We want to make sure that we connect via private cloud, public cloud, which API. You have to have the right AI infrastructure from the beginning. You have to have the right AI vision once you start, once you build your EMR, not 20 years after you're in the process, because that will get you better results. And we have to think about the privacy and anonymization of the data and the patients all throughout. So I talked about trustworthy AI and regulation and a little bit about explainability. Well, physicians, clinicians, they like to know what they're doing. They like to be in charge, and we want to provide them with insights, but we don't want to replace them. We want to assist them. So we need to include them in the process, but we also want to make sure that they are provided with reasons to why the system is providing them the insights it's providing, because we want to have them using it the next time. So this is the physician in the loop in that sense. Next, we're looking, if we want to zoom in, into regulators. So the FDA is increasingly improving AI applications, where we see a lot of work done around pathology, around radiology, and other domains are entering as well. But what's important to take into account here is the fact that FDA and the healthcare system are embracing the AI revolution. They're saying these are great tools, we want to use them, but they are conscious also of the AI hype and want to make sure that they have the experts that provide them with a solution to how they monitor their AI applications, how they make sure they're reliable over time, giving the dynamic data nature. And this is also something to take into account, because if you have to get a new FDA approval, which is a tedious process, to every version of your model, then perhaps there is a smart and efficient way to get it done. So today I want to highlight 2 use cases from our work to give you a bit of a sense of the data science journey. Okay, so when we're talking about the data science journey, we're starting from the vision. Okay, and this is the important part. This is the deal breaker. This is what will generate the most value. So starting from the beginning, we want to have the right formulation of your clinical problem or your business problem in machine learning terminologies. And this is very important, and this is something that is knowledge that is acquired throughout a lot of applications that have been developed. Afterwards, we want to, when we start the project, we want to look at the exploratory data analysis. So we're at our core researchers. We're looking at whether or not the data has a story to tell. Okay, once we receive the data from the EMR, from the hospital, from the patient, whichever, then we're moving on to really developing and optimizing the model, to the initial benchmark model, and want to get it ready and deploy it to production setting. To production setting, meaning we want to have physicians relying on it live, pharma companies relying on it live, and this means that it has to be very, very accurate and precise. And there are tools to get it done, but this is not a simple matter. The majority of the AI projects, 87% of them to be exact, according to Gartner, never make it to production. And the end is the monitoring, because monitoring is crucial when we think about the fact that that we're talking about healthcare and human lives. So, what can go wrong? Practically everything. Vision. Looking at the AI as a means to an end, that's crucial, because we don't want to necessarily have the shiniest algorithm. We want it to be the most accurate. Data transfer between the different units. When we're talking about EMRs, we have a lot of the time, we are very close partners with Sheba Hospital, 9th best hospital in the world according to Newsweek, and we sit at their artificial intelligence committee. And you know, when we look at hospital data, there are a lot of different databases that we need to take into account in a single application, and we want to have the right AI infrastructure and AI approach to maintain the semantic correlations between the different entities, and to really address the different correlations and how to consolidate the data from the different data sources in the most optimal way. I want to take a deep dive and talk a little bit about MDPI and the two use cases that we've done and developed with MDPI, because I believe it will give you a sense of what can go wrong in a data science project and how to save it. So MDPI, our prescriptive clinical decision support system, accompanies you from the research phase to the monitoring phase. It's a set of machine learning algorithms we've developed for the purpose of the prediction of patient deterioration, whether we're talking about COVID-19 or any other medical condition. And it's a general framework that handles the clinical data, from genomic data to clinical notes to signal processing to imaging data to EMRs. And this is crucial because you want to address and manage each of these different data types differently. And last but not least, we want to have the different stakeholders in the healthcare ecosystem to receive different insights, because we know that they have different motivations and we know their AI solutions must be customized to them. So COVID-19. In the beginning of the first wave of the pandemic, our partners at Chiba offered us to participate in this data challenge that they had. About 33 groups participated from large corporates globally, with the attempt to develop an early detection system that really predicts the likelihood of a patient to deteriorate. And what we found there was that we developed a system, and it allowed the physician with an explainability component, meaning offering them insights as to why this patient John will likely to deteriorate. Within 6 hours, we viewed a few hundred patients at Chiba, who are leading the National Front in COVID-19 in Israel, and we've developed the models that will look at them both based on the initial data that they entered with the intake data and so forth, and also updated based on the measures that they keep measuring the clinicians. And this was a great success. We came in second place in this challenge after Intel, and we are now actually live at Chiba with physicians using this platform to predict deterioration of patients. But the challenge here was something else. Throughout the process of the development of the model, we found that the results looked too good. What does it mean, look too good? We looked at our measures, and something seemed fishy. I talked about the methodology before. We have our patented methodology of error analysis and prioritization throughout the development of the AI models. And we looked at this specific model, and what we found through this process was that some data is not transferring from the ER when the COVID patient is being admitted to the COVID department while they're being after they're being hospitalized. This was crucial, of course. We notified the clinical team. All the other teams updated their models accordingly. But if we didn't have the right process, we never would have found it. And we were actually the only team that came across this finding. And if that model would have been in production, well, it would have provided very inaccurate results to the clinicians. And all models would have provided, from all different teams, because all of them relied on inaccurate data. Second, clinical notes and genomics. We developed a solution to extract predefined ontologies from free text written by geneticists. Here we also use deep learning models, and what the challenge was here was use NLP, natural language processing, for the purpose of analyzing free text that was not tagged, and extract codes that match the specific terms in the text. And throughout the process, we found that what they wanted their ideal solution for matching a specific term in the text or a specific keyword in text per specific code was inaccurate and was not sufficient. So after sitting with the product team, we came to the conclusion that it's best to present it in a different way and highlight different parts of the text and connect it to a limited list of codes, so that the clinician here, the researcher in that sense, will be the one making the informed decision and being a part of the process of really validating the model. So I just want to sum things up because I have to finish. If I want you guys to take anything from my talk today, lessons learned in the data science journey: data. N equals 20 is not enough. We need access to data, remote access to data. We of course have to be GDPR compliant and maintain the most stringent regulation and privacy concerns, but we have to have access to data. Second, data strategy at point 0, and this connects also to the AI out of the box. When you want to start doing AI, you have to have the right experience and AI applications and infrastructure to facilitate the development of these models, because there is no AI platform that does this, and there is no AI that will replace the physician. There is AI that is managed and researched and in a robust manner, and that is the only way to deliver value and improve clinical outcome when we're talking about healthcare here. And question your findings throughout. It's a marathon. So you start with a benchmark model, but it usually takes time to really reach the goals that you want, and this is the most important thing. When we're talking about AI in healthcare, engage your clinicians. They are your human brain that will improve your artificial brain. I can't stress this enough. And they will improve your algorithm, and they will validate it, and they will have to be a part of the process. Actionable insights. Don't ask what, ask why this is happening. Ask what can you do with it, and this is crucial. What can you do with it? What will my clinician in my hospital be doing differently after he receives the results of my model? And always remember that true innovation in healthcare requires sustainable, explainable, auditable, robust AI solutions. Thank you very much for your time. And if you want to contact me, feel free. I am at this email. Thank you.